So how did the SmartStack technology change it up for you? How did that change the CO₂ usage and how did it change it for your results?
Absolutely, it changed the results very much.
How did CoolPeel technology with Tetra Pro from DECA changed your approach with the patients?
Actually, when we are working with CO₂ laser devices, the most important things that maybe make concern for the doctors and the patient about the downtime and the heat effect of the laser.
The more I sit with people who use CO₂, I'm like, you know what, maybe one day.
At the beginning, all the patients are hesitating because when they search through the social media, they hesitate and they scare about the treatment. And when I finish it, the patient, they tell me, finish?
Hello and welcome to the first episode of Beauty Beyond Limits. My name is Hosni Chaban and I'm going to be your host for today's episode. Beauty Beyond Limits is a show where we delve deep into the world of aesthetics and dermatology and we pick at the minds of the geniuses behind the technologies that are taking over the world and also the geniuses behind the machines that are working the machines and setting standards. Speaking of, I'm joined by my beautiful co-host, Ms. Rasha.
Hi.
And we're joined today by the most talented person in this industry right now, a person who's not only setting standards, but also starting trends in this field. We're joined by the beautiful Miss Helia.
Hi, I'm so happy to be here with you in this podcast. My name is Helia. I am a laser physicist, international laser trainer, and also I am a laser specialist. I've been working in this field for more than 15 years. And I'm so glad to be here with you.
It's our pleasure to have you, honestly, and genuinely, like your social media, which by the way will be linked. You guys should follow her.
Thank you.
It's taking the whole market by storm. Genuinely, I get sent some of the stuff that you do, some of your reviews and some of your patients. You guys will see soon what Ms. Helia will speak about in this episode will literally change the whole industry. So I'm looking forward to it. I'm very excited about this episode. So let's delve right into it. So today, our topic of discussion is the new CO₂ produced by DECA, the Tetra Pro, which I'm pretty sure you're very familiar of. So we're going to start with our first impressions of it. How did you find the Tetra Pro when you first looked at it? How did you find about DECA CO₂ in general? How was your first impression of the DECA CO₂?
Actually, when I started to work with DECA CO₂ laser, I can say in two words as precision and flexibility. Because I used to work with the other CO₂ laser devices, but it gives me a variety of laser adjustment. When I'm using a CO₂ laser, there is two most important parameters that we should focus on it. It's about the depth and the heat of the laser. It's important for me that when I'm using a laser on a tissue, I should know that in which depth of the tissue I'm working, and the spread of the heat on the tissue is really important for me. And I can say that DECA CO₂ laser is the only device that gives me this opportunity to adjust all the parameters of the laser, and I have a full control of the laser on my patient.
That's beautiful. That's beautiful.
Ms. Helia, now with the Tetra Pro, the new generation of CO₂ laser from DECA, we have the standout feature which is the CoolPeel, which is basically a lunchtime treatment with minimal downtime. And here the CO₂, some patients, they are afraid of using having this treatment. So how did CoolPeel technology with the Tetra Pro from DECA changed your approach with the patients, those patients who are afraid of undergoing this procedure?
Actually, when we are working with CO₂ laser devices, the most important things that maybe make concern for the doctors and the patient about the downtime and the heat effect of the laser. So DECA CO₂ laser devices, Tetra Pro, it gives us this opportunity that we can eliminate the heat effect of the laser and we can control the ablation of the laser on the surface of the tissue. We can have the same effect of the laser with less downtime, with less risk of hyperpigmentation, and increase the healing process of the treatment.
So basically, we can use it on even dark skin types. and
Actually,
that's-
yes, because when we are working on dark skin types, it's very important for us not to give that much heat to the tissue, because it will lead to
Stimulate.
PIH. So when we remove the heat effect of the laser and we only just ablate the skin, it will give us the result, a safe result on the dark skin type.
We can consider it like a skin rejuvenation for the patient who doesn't want to undergo like a long downtime.
Actually, yes. The concept of the laser is the skin rejuvenation, new collagen, new elastin, fibroblast activity, and we reduce the heat effect and we increase the result of the laser. So especially here in Dubai, in
Yeah,
high
with the-
temperature,
And no compliance
Yeah,
from the patient.
it's very difficult, but it gives us this opportunity how to work on dark skin types and the same effect of the skin rejuvenation.
Perfect.
Perfect. I want to tell you something. So I've been stalking your Instagram nonstop, and I saw you are doing this like your CO₂ for the lips. Tell me about that.
It's my favorite work. Yeah, exactly. Because I can say that this is my own innovation. Because I'm not sure about it, but for the first time when I use it, just a patient came to me and she asked me, "Could you please work on my lips as well?" I said, "Okay, let's try it." But when I tried it and see the result, and I changed the adjustment of the laser on the lips, I saw it is very useful for lip rejuvenation. And now we can call it rosy lips, pinky lips, something like this. It's really appropriate for the patients who doesn't want to go for the filler injection. They're afraid of any kind of the injection. They want just to have a natural look without any aggressive treatment, because the downtime of the lip rejuvenation with laser is really shorter than the other part of the skin. It's only 1 or 2 days, but the results is amazing because it will give us more hydration, plumpy lips. It will refresh
Natural
the
look.
skin. Yeah, it will give us a really good results on the lip rejuvenation.
I think genuinely everyone, I'm talking about, of course, every doctor, by the way, you guys have to try this, but you have to ask Ms. Helia to give you the parameters. I'm not going to help you there. But I feel like every patient should try this thing, this
Yeah, of
treatment.
course.
The results that I'm seeing,
Very
the before and
natural.
after, wow.
Yeah, it's really
Like-
natural results.
Wow, yeah. I showed, like, I was once sitting with a doctor and I showed them the pictures, your results, and they're like, "No, this is not real." I'm like, go ask her.
Exactly.
Like, it looks amazing, like,
Yeah.
genuinely. So, and you are, I think, the first one. You mentioned it right now. I think you are the first one to do it.
Yeah,
Like,
exactly.
genuinely. So we need to name the treatment after. I call it the Helia treatment.
Helia
Lip. Helia
Helia
lip treatment.
lips.
Yeah, I swear we need to like give credit to
Yeah.
the treatment.
Yeah.
Exactly.
In addition to the lip rejuvenation with the CO₂, you're using, doctor, as well the CO₂ laser for face tightening intraorally.
Yeah, exactly.
Where did the idea came from?
For sure. Actually, when we are doing laser rejuvenation, this is not only the surface of the skin. I can say that when I use these methods, it can be from inside to out, because inside the mucosa of the lips, intraoral, we have the fibroblasts, we have the collagen, we have the elastin. But when we target the mucosa inside intraoral, we can target the mesolabial fold to, I can call it 360-degree rejuvenation, because it will give us a really good results on the firming on this area around the mouth or in mesolabial fold.
Yeah.
That's very
And
good, Yani.
how-
Usually we don't think
Yeah.
about the CO₂ inside we are afraid from CO₂ on the skin, not from the sun.
That's really
Actually, yeah, it's a little afraiding, but I can say that when I use this CO₂ laser intraoral, the patient doesn't feel that much without
no
any
pain.
numbing, no pain.
no
No
numbing.
numbing cream.
No numbing, nothing.
Really?
Right, yeah.
Oh wow, that's
we
actually
were
really
talking,
nice.
we were
Yeah.
discussing this
Because I was like,
today.
for sure, probably there's numbing, but there's
No,
no numbing.
nothing.
Oh wow.
No, and the patient doesn't feel that much. But the most important things that DECA give us this setting, because DECA, it has a special adjustment of the pulse shape
Parameters.
design
Oh.
that calls DECA pulse. And the concept is coming from the Mona Lisa touch that we use the CO2 laser
For-
in mucosa rejuvenation for vaginal rejuvenation.
Exactly.
So the CO2 laser
That's really
is
good.
absorbed by water. So when we want to work intraoral, we have a defense of water inside on the mucosa. So DECA give me this setting that I can remove the defense of the water on the surface of the mucosa and go deep to the dermis layer and have the effect of collagen production, new elastin, new fibroblast activity, more hydration, and the firming effect of the laser.
That's really
actually
interesting.
really good. I
honestly.
feel like I want to low-key try it.
Yeah,
I
it's really
swear.
amazing because I have some patients, they are into this treatment. They come every month to me and they want to do it. It's easy and there is no downtime.
So you usually do one session or
No, it
more
should
than
be,
one?
yeah, it should be more than one session. Actually, when we want to get a long-lasting result,
Yeah.
if we go for 3 sessions or 4 sessions
1
every
month apart.
1 month,
Okay.
it will give us a better results.
That's very good.
Doctor, I want to tell you, speaking about the parameters and stuff that DECA innovated with this machine, they also introduced the option with the Tetra Pro of smart stacking.
Yeah,
So
exactly.
smart stacking is, as you know, it's the option where instead of shooting 2 shots simultaneously, it will stack them on top of each other to mimic the effect of like repeated shots. So it can go deeper, but with less dissipation of heat. That's the whole concept.
Exactly.
So how did the SmartStack technology change it up for you? How did that change the CO2 usage and how did it change it for your results?
Absolutely, it changed the results very, very much. I can say that, for example, if we want to have a good results of the laser rejuvenation, as much as we go to the deep dermis layer of the tissue, we can get a better results. But in all laser devices, I can say that as much as we want to go to the deep dermis, we should we damage the surrounding tissue of the surface area. But the SmartStack give us this opportunity that go deep to the dermis layer without that much damage to the surface of the skin. I can give you an example. Think of it like hammering a nail to the wall. Instead of hitting one hit that damage everything on the surrounding area, we can give a small, fine strike on the nail and we penetrate the nail to the wall without damaging. Yeah.
Oh, that's actually, I like that.
Yeah, so Ms. Helia, back to using CO2 in the delicate areas like the lips and intraorally. At the beginning, were you hesitant using the CO2 in these areas? Can you share any?
Yeah, absolutely. In any first experience, there are hesitation. So, but when you know the science behind the technology and you know the tissue and the tissue reaction to the laser, you can manage everything. Actually, at first I was hesitating, but now I do it confidently.
Yeah,
really.
it's the same like using it on the
of
face or
course,
any
yes.
skin area.
Yes, and actually I try to follow up all my patients. Still, I follow up all my patients, especially for the first few days. And
It's very important.
slowly, I discovered that it's really amazing.
And you will be more experienced.
Yeah, of course, yes.
Speaking of patience, we want drama. We want something, you know, like we want something different a bit. We're gonna go off topic a bit, but staying within the whole thing. Give me something juicy. Give me some like funny story that happened. I bet you go through a lot of things, and knowing like the market that we're in, there's probably a lot of patients with different, you know, like stories. So I want to hear. Tell me something funny that you went through.
Actually, if I want to say, there are a lot, but I can explain about one experience with one of my patients. I have a patient, she rapidly come to me every year from USA. It's about 4 years. Each year she comes once a year. And each time she come to me, she doesn't tell her friends that I'm coming
For the procedure.
for vacation. But she directly from the airport come to me and I do a CO2 fractional laser, and after 10 days her friends meet her. And she always tell me that all my friends asking me, what are you doing each year? You go back to USA and you come back 10 years younger. What happened to you? What is USA? What is
don't know
going
it's
on there?
actually here.
Yeah, exactly.
Tell them it's the water. She's telling it's a
Yeah.
secret. Always tell them the water.
The nature.
The nature.
Atmosphere, maybe.
See, I swear everyone wants to gatekeep, you know, like I feel like also if I had like, you know, someone like Dr. I would just gatekeep her. I won't tell everyone. But no, that's the market we're in, right? People like when you find something like a gem, right? And honestly, not like because you're here, you are like a gem in this field right now. So they wanna, you know, they wanna feel like, no, you're their secret right now. But today we're making the secret for everyone.
Exactly. One another story I want to tell you that, for example, in my this is my job. When I go through any street, any shopping, I just like a robot, just just
Checking
check
the
everything
patients.
on the people's skin. I was sitting in my clinic that I found a lady. She came to the clinic and she was super beautiful on her skin, shiny skin, glowing, hydrated. I said, okay, why she's here? What she's coming here for? What is her purpose here? And then I went to her and I told her that, can I ask you that what is the secret behind your this shiny skin? And she shocked and she told me that, doctor, you cannot remember me? You have done treatment for me with CO2 laser.
Totally different person.
Yeah, and actually, even I couldn't remember her. And I checked her document to see when she came to me. It was 6 months ago, and she was totally changed. I couldn't recognize her at all.
Oh my God.
So what was the secret?
The CO2 laser.
Plus Helia's touch.
Of course.
It has to be. Plus Helia's touch.
Definitely,
Yeah.
definitely.
I have a question because I go through this all the time. When people think that we're in this field, even as practitioners and obviously as us, like when we work directly with the suppliers, they always ask us like, how's like, this is my life, this is who I am now, right? So outside the field, outside the clinic surrounding and doors, do you still get badgered by your friends, for example, or family all the time? Like, tell me, what do you think I need? Like, do I need filler? Do I need Botox? Do I need, is it always like that? Or
vet all
do
the
outside
time.
you close? This is
No,
it. I'm now I'm Helia, not.
Not the practitioner
Now, please
anymore.
tell me.
No,
Like,
to be honest, even when I'm sleeping, I'm thinking about my job.
Yeah.
I giving consultation, and the first option that I suggest to everyone before any treatment, I suggest to go for the CO2 fraction, because this is the only methods that give us the long-lasting results. And by passing the time, the effect of the laser will increase more and more. Yeah.
that's actually true. I feel like that's the most natural way to achieve it. Also, at the end of
For
the day.
everything, for the fine lines, for skin
Exactly.
rejuvenation on the long run, it's the most natural.
Yeah, the people are looking for natural look, natural changes.
Nowadays,
Yeah,
yes.
nowadays everything, the trends is changing, and all the
Exactly.
people are looking to find a solution to be natural without makeup, without injection, without aggressive treatments. The
Without
CO2 laser,
this exaggeration and the filling.
exactly. They want to look natural, beauty natural, and
Yeah.
the skin is the most important part of the
100%.
beauty, I think.
100%. We are in this time of anti-aging more than it is now just aesthetic. Now it's like
Yeah.
the time for anti-aging. We have to
Laser
like,
devices in
yeah,
general.
like
Or
forever young concept where everyone is trying to be 20, 22
Yeah,
for the rest of their
exactly.
lives, right? So I feel like that's something that's a huge step. You're right, 100%.
And I can say that the CO2 laser reverse the, not only stop, it reverse the
Reverses it.
aging. Yeah.
I want to get to that. See, I was always like at this thing where I'm like, no, I'm fine. I don't want to try anything. But like the more I sit with people who use CO2, I'm like, you know what? Maybe one day. And now I feel like it's about time. So maybe I'm gonna give you a call.
yeah.
But
Reverse
actually,
the aging.
You haven't tried it yet?
Huh?
You haven't tried
No,
it?
I need to
Oh
try
my
it. I
God.
need to try. I'm like one of those people
actually,
You should.
at the beginning, all the patients are hesitating because when they search through the social media, when they read about it, they hesitate and they scare about the treatment. And when I finished it, and when they come, they say that, okay, this is the first and the last time that I'm doing
They
the
would come
laser.
back.
And when I do the treatment and it finished, they say, because I have some trick in my work, the patient doesn't feel the pain. They're very
You have your
pain.
trademark.
Yeah, this is my special way. That when I finish it, the patient, they tell me, finish? Just this. But to be honest, in the first 2 days, they should take care a lot about their skins. And again, in the same 2 days after the laser, they tell me that, okay, that's enough for us. I don't come back. But all my patients, I can say that 99% of my patients, when I do this treatment for them, after few days, I can say that they ask me, what is the next step? What should I do the next step? Yeah.
It's like you're a genie that just worked some magic, and now they're like, okay, now I'm interested.
Yeah,
now I want to know.
You have to try it.
I'm like,
Sure.
like now I'm like more convinced.
He will.
Yeah, I swear, I need to I'm aging. I need to do something about
But you're young.
You're still very young.
Yes.
Speaking of which, doctor, some practitioners still think that the CO₂ laser is an aggressive treatment. It's a heavy treatment with long downtime, and especially that the patients will not have that compliance, so the side effects will happen. What is the most common myth that you heard about the CO₂ lasers in the field?
Actually, if we want to divide the laser devices, yes, CO₂ laser is an aggressive laser, yes. But actually DECA CO₂, it gives us a lot of opportunities and capabilities of laser adjustment that we can reduce the downtime, increase the results, but to be honest, first 2-3 days after the laser is really important. But as much as we work aggressive, we can get a better results. Because I use all the methods of the rejuvenation. I use all the ingredients in the market. You know that there are a huge market of different ingredients. All the companies, they say that this one is good, that one. And really all of them are good. But all these treatments, they have short results. After a while, you feel that the result is going to be vanished. But the CO₂ laser is the only technique that there are a lot of studies, clinical studies, that you can find that by passing the time, for example, 2 months after is better than 1 month after, 4 months after is better than 2 months after. And by passing the time, you see the improvement of the skin. And if the patient have a rapid, just good home care, the result of the laser can stay for a long time.
It all depends on the parameters that you will be using. So each patient will be treated differently than the other one.
We cannot use the same technique for all the patients. We should
having the same results at the end of the day.
Yeah. At the end, all of them, they have good results, but we cannot go with one adjustment for all the skin types. We need to evaluate the skins, the skin hydration, the skin thickness, the skin concerns, the concern of the patient. All are important to adjust the laser setting to get a better results. Yeah.
But speaking of, you said something very, very important, and I want your kind of small advice. I don't want you to tell like the whole thing maybe, but what would be your recommendation as a post-procedure then for your patient? Like someone who's just done a CO₂, what would be usually your advice to your patients? What do they stay away from? What's their best friend during the first few days?
It's a really important question. I can say that I do 50 to 60% of the treatment, and 40 to 50% of the results is based on the patient, because I had this experience with some patients. They come to me, and before starting the treatment, I tell them that you have to have a good home care after the laser. It's really important, especially, I told you, the first 3 days and after that first month of the laser treatment. If I see the differences in the patients who have a good home care routine after the laser, and they take care of their skin, especially with SPF, especially in Dubai with the sun.
Wear SPF.
They get a better results. In compared to the patients, I have some patients, they told me that I come to do the laser, and why I'm here, I don't want to do any other home care. No, it's not possible. They have to have a good home care. It's a part of their treatment.
It's a full circle almost, the treatment. If you can do the best you can here, but at the end of the day, they have to take care of themselves. Right? This is
SPF is very important.
It's very important.
Yeah, I've heard stories of people that do lasers in general and then go to tan in the beach the next day. Like
I get a promise from my patients. I tell them that if you go tanning, for the first month to 45 days is really important. Even the UV in the home, it can damage.
The lights.
The SPF and the hydration. Keeping the hydration of the skin and SPF. These are two important things after the laser.
So moisturizer and the sunblock are the most two important.
Exactly.
When would you recommend? So I know people will probably ask this a lot in the comments maybe. When do you think will be an appropriate time to go, let's say, to resume your life normally after your session of CO₂?
I suggest at least 45 days to maximum 2 months.
And that's how you can, that means you can go normally, as in you can go tanning, beach.
Yeah, exactly.
So it's almost the same as lasers. Even with hair removal and everything, we tell them the same thing. We need to.
Yeah, but it doesn't mean that, for example, they cannot go out, they cannot go to work. I have a lot of patients, even the day after the laser, they go to work. The peeling after the laser, it takes around, it depends on the patient's skin, it takes around 5 days to maximum 10 days.
So for the patients that they've just done their CO₂ laser treatment, you're telling me you can continue your life basically normally.
Yeah, exactly.
But what would be the protocol that you were telling me about?
Actually, the first 2-3 days is really important, but it doesn't mean that they cannot go to work, they cannot go out. They can do whatever they want, but they should take care of their skin. The most important time is the 3 days after the laser, but the peeling effect of the laser, because when we do the laser, there would be a cross skin on the surface of the skin that protect the down layer of the skin. And whenever the down layer is prepared to come up, the superficial skins that are the dead skin cells will start to peel off after 4 to 5 days. In some cases, it takes maximum to 8 to 10 days.
Depends on the aggressiveness of the treatment.
No, it depends on the body response of the patient. Some patients, they heal fast. They have good healing, but some they heal
But it's all manageable at the end of the day, right? Like it's not
exactly.
because people are, this is like what Rasha was saying a little bit earlier, is like there's a misconception for both, even for like the patients, they fear that, oh no, I'm going to sit at home, I'm going to look like a vampire for 2 weeks.
No, it's not like this. To be honest, it's not like this. Even I share a lot of after pictures immediately after the laser, 1 day after, 2 days after, 3 days after. You will find that it's not that much. The people understand that you have done something on your skin, but it's not ugly. Even I have some patients, because the laser, it gives us the firming effect. I had a patient just 1 day after the laser, she went to a party and she took a video, selfie, stories, and I asked her, how did you go to it was a big party, and I asked her, how did you go? She said, no, I like this firming. I've never had this firming, and I like it.
That's nice.
Yeah.
It's like a glowing effect, maybe even like a little bit. Oh, nice. So I think we're almost done. I think now we'll do the closing. Do you have anything before we continue? Do you have anything you want to add? Any topic you want to speak about that? We went almost everything, but I want this to be your part now. What do you have? Anything you want, a topic you want to speak?
I do a special things for the eyelid rejuvenation. I want to talk
did not speak about the eyes.
It's you know, this is one thing that they can do.
Please.
Doctor, so Miss Helia, so you are famous regarding the lip rejuvenation, the intraorally facelifting, and then now you have the blepharoplasty.
Non-invasive blepharoplasty with laser.
Yes, with CO₂ laser.
Yeah,
Can you talk us?
It's incredible. It's incredible because it's a really fantastic treatment for the people who doesn't like to go to aggressive treatment. And for example, we can do it especially around the eyes. It will give us the same effect of the blepharoplasty, but not in one session. In each session, they will see the improvement of the eyelid. And I have a lot of patients that they send me their after pictures. They say that this is after a long time we see our eyes, because and even they couldn't have any makeup before, they couldn't, and they say that okay, it's the same result of the blepharoplasty, but non-invasive, short downtime, and it can
Less
be
expensive as well.
done.
Or no?
For the laser?
Yeah.
No, it's not that much
Same
expensive.
as surgery.
Yeah,
No,
less
it's
expensive, we're
less
saying.
than, less
Yeah, yeah,
expensive.
Less expensive. This
Yeah,
is
it's
what I mean.
more cost benefit for the
Yeah.
patients.
Yeah, exactly. Instead of going to surgery.
Exactly.
Does
And
it cover, doctor? There's a lot of people that I know there is another. So they say for dark circles, it depends on what it is. If it's something that needs filling, but you'll go to that. But also, I heard a lot of doctors and yourself using the also CO₂ for something like dark circles to help with the pigmentation a little and the tightening of the hair.
Exactly. I use it for the dark circles or under eyes, for the wrinkles, and for the skin laxity around the eyes. And actually, I can say that sometimes I combine it with other methods at the same time, but without injection. Because laser itself, it creates some microthermal zones on the skins. And when I apply some ingredients on top of the laser, instead of the injection, it will absorb by the zones that created by the lasers. And the result of it is amazing. You can see the improvement in each sessions, and it will make the patients addicted to the treatment. They come by themselves for the next sessions. Yeah.
There's a famous line by, was it, I think Al Pacino or someone said the eyes, they never lie. And I think the eyes Chico, they never lie.
Yeah, exactly.
So it's, I feel like the eyes are the soul to everyone, and that's like the main part that you want to take care of. So if you're looking for a less invasive, simpler way, DM Miss Helia. I don't know if she'll have enough space for everyone, I think, at this point, but you need to try it, because I think we will show the results also. Like,
I will
it's
share
something
a lot
magical.
of before and after pictures. You can see.
I have one last question, Ms. Helia. So after, let's say, 4 to 5 sessions, when do you suggest to have another session of the CO₂?
For the full face, or
let's
for
say,
it depends on the patient, and it depends on the area. Sometimes for the full face rejuvenation, maybe I do only 1 or 2 sessions, and the results is really amazing, and it lasts. And I suggest the patients just to keep rejuvenating, do it once a year. But for around the eyes, it's different, and for the lips, it's different. We need at least 2, 3 to 4 sessions, depends on the patient.
And the maintenance, like this?
Once a year.
Once a year.
Yeah. Oh, that's very doable.
Fair enough. Yeah.
Okay. So you're saying other than full face? Sorry, I know we're not getting a bit, but so you can do it also for the full body, right?
Yeah, exactly. I do it a lot. I have some patients that I do the laser from their
head
hair,
to toe.
hair to toes. Yeah, I do it in any part of the body.
We focused on the face. However, we have other indications except the skin rejuvenation of
for
the
any part
CO₂.
of the body, because when the patients come and see the result in one part of their body, and they will like to do it to the other, on the neck, on the breast, on the stomach, on the buttock, on the axilla, for the intimate, for their arms, for their legs. I do it for everywhere.
Hand rejuvenation as well.
Yeah, exactly.
It's like this movie, like this cartoon, when you bring someone in, there's like a door, they come out different,
Exactly.
Same as her patient.
I had a patient just recently. She came to me, and it was really interesting for me. Actually, I didn't want to do for her. She came to me and she wanted to do laser on her toes. And I said,
imagine.
What?
And she was young, and I said, okay, why you want to do it? How you see your toes? Yes, exactly.
What's in your toes that bothers
but
you?
she insisted to do that. Okay, she insisted to do that.
And you serviced your clinic.
That's we need to find a new name for this treatment. CO₂ for the toes.
Exactly.
Head to toe CO₂.
Head to toes. Yeah,
I
exactly.
like that.
It's a good name.
Yeah. So you can take the ending, Hella, just like
okay.
About the intimate part as well, because we have a lot of patients for the intimate.
Mm-hmm.
Yeah.
So
the
let's start.
Intimate rejuvenation is really amazing.
So
Yeah.
when it comes to, so you've mentioned like a bunch of times now the intimate. So when we're talking intimate, is it external, internal? What can you
What's
offer with the
exactly?
CO2 for the intimate area?
Actually, the rejuvenation for the intimate, it can include the inter
And out.
and outer, yeah. And actually, I can say that in the intimate part that we are not worried about the sun exposure and the
That's the most
UV.
important thing.
So I can do the laser a little aggressive, but not that much. The downtime in the intimate part is less than the face, actually.
Oh,
Yeah.
really?
Yeah.
And the result of the firming and the lightening effect in the intimate part is really amazing.
The external
Yeah,
part.
exactly.
Yeah,
'Cause
whitening
I
effect.
always say that I have a big album of before and after, and the
Okay.
patients, when they come and they see the albums, and they really shock.
Yeah.
Really?
Yeah.
But sorry if I ask, but like I feel like as a patient, the first thing I will think if I'm saying intimate area laser, I'll be like pain. What about the pain sensation then?
Same as
Yeah, I
intraoral.
have for the intravaginal there is no pain, there is no
Oh wow,
sensation
no
of
pain
the
at
pain,
all.
nothing, not
Oh
at
wow.
all. But for the external area, actually we use the numbing cream, and I have a special technique of mine that the patients doesn't feel anything, even when the patients leave the clinic, and they tell me that sometimes we forget that we have done anything.
And the duration of the session is not that
Actually,
long,
it's better
right?
to be 1 month apart.
No, the duration itself.
And the duration of the treatment
of the
sessions.
treatment session is not it's not that long, same as the face or other
It's the
parts.
same.
Same.
It's the same,
Okay.
almost the same. It takes around 20 minutes,
Okay.
15
that's it.
minutes,
Okay.
something
Yeah,
like
yeah,
this.
yeah.
Yeah.
I can't believe it. You know how like now with the time we've moved, I feel like you can change a whole person in just like
Hello.
30 minutes. You can change. It's a new person now.
Yeah,
You know,
exactly.
just maybe also color their hair. That's it done. You know, like
Yeah.
new person completely. You would not even know who just walked in and walked
Exactly.
out of the rooms. It's
Exactly.
amazing, honestly.
Yeah.
No, but like especially now that you're talking about the intimate, because I feel like a lot of people have a misconception because they always attribute. I'm one of them in the beginning. Like they always attribute to intimate as something you're shy about, and you feel like that's it. I'm born with something. I can't do anything about it, and they always attribute it to fear of pain and shyness. But now that you're saying it's a very easy treatment, it's a very
Yeah.
quick treatment, and
Yeah.
it's
And
a
it's very
painless.
common.
Yeah.
Yeah, we
Nowadays,
have a lot of
yes.
patients that
Yeah.
they're asking for the intimate rejuvenation. It's really important. We call it the second face of a lady.
Yeah.
Yeah, no,
Yeah.
that's true, and I feel like you're right. It's not a lot of people think maybe it is common. They're afraid that it's only me, and they're shy. So that's good. So now, if you guys are watching and you have something, you know where to go. Also,
Yeah. Exactly.
Miss Helia, thank you so much for your insights and honesty today.
Thank
It
you.
was really full of knowledge. Do you have any last thing you need to add?
Thank you for having me here today. And I know that this is a kind of treatment that the patients, most of you, they have a lot of questions. And to be honest, in the social media and in the Google, especially the chat GPT, it cannot give you that.
A lot of misconceptions.
Yeah, there are a lot of misconceptions, and they cannot give you that much information because it needs knowledge, it needs to know the science behind the lasers. If you have any question, I'm free to answer all your questions, and my consultation is free for all of you. Just direct me for any free consultation. I'll be with you.
oh, that's so lovely. Like,
Yeah.
she's helping
Don't
all of you
forget-
out, guys, like quickly, like before
Don't
she changes
forget
her
to
mind.
follow Miss Helia for the lips rejuvenation, the intraoral facelift, and
Eyelid
Eyelids.
rejuvenation, intimate
well.
rejuvenation.
Full
intimate
body
Full
rejuvenation.
body
Rejuvenation.
for everything.
Full body for
Yeah.
anything that you're ever been considered in your life. This is where you have to be. Like, please follow her. We're gonna link her profile in the
course.
either in the caption or in the screen right now. Make sure you follow her. She's one of the most beautiful and most humble people you'll ever meet, and we're sure that she's gonna be the best thing that probably ever been happened to your life.
Your
also.
way to go.
Thank you very much. Thank you.
Thank you
Thank
so
you,
much.
Miss Helia.
Thank you.